this has to fundamentally do with how people make decisions, but it's also going to translate into how a firm would make decisions, because firms are run by people, and firms capture a lot of the same intuition as how people would make decisions, because they're run by people and they're dealing with the same fundamental galling fact that you have to wait for stuff. All right. So research and development, what makes pharmaceuticals different than other areas? They are heavy in research and development. So let's deal with making decisions over a long period. This is the rub. So remember, in cost-benefit analysis, we had to take into account that some benefit today has value to us and some benefit in 20 years has value to us, but it's not the same value. We're going to discount the future because it's far away. Who knows if I'll still be around? Who knows if I will still care about this thing? And I can't spend that money. If you say, I'll give you $20 next year, great. But I have my eye on a really nice, what can you buy for $20? It's good to know that I don't have any wants. But I have my eye on a pretty nice Marvel DVD. I just need to fill out that whole 25,000 collection of videos for the Marvel Universe. And I can't buy it today. So my collection is going to remain incomplete until next year when you give me the $20. All right. Discounting is going to show up here too. So remember this concept of net present value, NPV. Net present value. And this is going to mean we are taking into account value today, value tomorrow, but tomorrow is less useful. NPV is going to be equal to the sum over all time periods. T equals 1. T equals 1 to the final time period T. And this fraction where there's some value today, VT, value at time T, but it's going to be discounted by 1 plus R, where R is a discount rate. Maybe it's the interest rate, maybe you've picked something different that is appropriate, but in any case, it's a positive number. And this positive number is going to be raised to the T, raised to whatever time period it's far away. So if it's 20 years away, you're raising it to the 20th power, which means the bottom is very big when you raise that to the 20th power, which means this isn't going to end up being super important in 20 years. Versus today, that's raised to the 1. The value today is worth a whole lot more in net present value. Net present value. Some emphasis on the present. All right. What does that mean? Discounting occurs because today is worth more, and that risk matters a lot in this sense. Discounting means today is worth more, and risk matters. Why does risk matter, and especially in this discussion, is that if your future stream is uncertain, you're going to have some kind of discounting over uncertainty as well. Future income stream is uncertain. So you've got kind of a double whammy. It's not as valuable because it's in the future, and then it's also going to be not as valuable because you're going to face that curve, that indifference curve. We could use it for a firm too, because usually firms' curves end up being sloped in the marginal sense as well. So this is going to be a problem. What would that look like in terms of the kind of projects you would or would not take on? And so in heavy R&D settings, net present value, it's probably going to have 2 periods. You're going to have period 1, where you're going to have lots of R&D, and period 2, when you're going to reap the rewards, so that you'll have the sales of this drug that you've developed. So from time T equals 1 to M, where M is whatever, when the R&D period is over, and then over here would be time equals M plus 1 to the end of sales. which might be a big number, but we're going to put in revenue minus costs in both of these scenarios on the top. Revenue at time t minus cost at time t, otherwise known as profits. Revenue at time t minus cost at time t. All right, now the bottom's still going to get 1 plus r to the t. 1 plus r to the t. And we're going to add them together. You're going to have what you get in the first R&D period plus what you're going to get once you have sales. But the problem is revenue minus cost here is going to be very low. In fact, if all you're doing is R&D and you can't sell it yet, guess what? The value of this will be. It would be actually negative because you'll have a huge amount of cost and absolutely zero revenue in the short run. So this is going to be low, or maybe it's going to actually be negative. And then over here, finally you get some revenue and your cost might be low because usually the marginal cost of producing a drug could be actually quite small. You're just accumulating the ingredients and you're putting in some wholesale production and it's not very expensive. So this could actually be quite high. High revenues and low costs. But you can see the problem here, right? This is all being discounted by some M+1 number, which is already quite huge. And as we went through in the approval process, it's maybe bigger than 12 years. And so this is the rationale for why do we have patents. If this is low or negative, you need this to be very high. How could you make this high? You could have low costs. You could also have high revenues. How do you get high revenues? Well, you get exclusive rights to make it and you get to charge monopoly prices for it. So that's the idea, why, that's the mathematics behind why do we let there be patents.